Continuing where we left off in part 1, we had just discussed the nidus state. Next, I'd like to mention that the husband and any other male, but specifically the husband, may not see the woman's genitals during the birth, and some believe that he should not be in the room at all during the time. Blessings are said upon hearing the news of the birth by the father and upon seeing his baby girl for the first time. They may also be said by the mother, but only when she is respectably dressed. Visitors and family members, including the father of the child, must be careful not to lose their tempers in front of the mother or the baby, as it may negatively impact either of them. For boys, ritual circumcision should be planned, which occurs on the 8th day, and for girls, a feast should be arranged. With the firstborn male child, a Paidan Haben should be planned, which is called the ritual of the firstborn, which is where the father brings the child to the Kohen, and when the child reaches the age of 13 days, and an offering equivalent to 5 selaim is given, and they commit to raising the child in Judaism and ask for forgiveness for the child. The woman is not allowed out of the house without accompaniment for 7 days following the birth of the child. Continuing with children ages 0 to 7, boys should be circumcised on the 8th day of their life. A feast should be prepared following the birth of a female child. Jewish children should be allowed to practice their religion during hospitalizations, and where it does not interfere with their care. Fasting and candle lighting may not be permitted by all hospitals, but should be negotiated with staff as necessary to help the children feel more comfortable and feel like their faith is being respected. Children should be emphasized with, rewarded, and allowed outlets to express their emotions about illness and healthcare. And generally, Jewish parents trust medical professionals. However, some ultra-Orthodox Jewish communities do not believe in vaccination. Recent outbreaks of measles and mumps have plagued the Orthodox Jewish communities, both in the United States and abroad, and many non-Orthodox community members have also been refusing the HPV vaccine for religious reasons as well. Children in the Jewish faith are considered adults once they reach the age of 13 or after their bar mitzvah for boys or bat mitzvah for girls. And once they are considered adults, they make their own healthcare decisions, though they should rely heavily on their parents' guidance and the guidance of other elders. However, the laws of the United States do not permit them to sign for themselves or to make decisions on their own, so caution must be used, though they should be treated as adults at that point. For adults ages 18 to 64, medical care by medical professionals is expected under Jewish law, though many prayers and rituals are also incorporated into their healing process. Ill patients may have many visitors, as visiting the sick is a requirement of the religion. It's important that visitors adhere to policies regarding isolation precautions and visiting hours, though they're encouraged because they have a positive impact on the recovery of most Jewish patients. Many social resources exist for Jewish patients within their religion because, again, the Jewish people are required to give back to their community, and therefore resources exist in places with large Jewish populations. However, in outlying places, fewer resources may be available. Orthodox Jewish women may not be seen by men other than their husband without the presence of a female of the faith. This is especially important when we only have a male physician in the hospital to see a female patient. It's important to note that someone else must be there. Procedures which mutilate the body in any way, including the removal or transplantation of organs and amputation, should be discussed on a case-by-case basis, as theories and views on that vary widely across the Jewish religion and the different factions of the Jewish religion. However, blood transfusions are always permitted across the board. And special care should be taken with patients exhibiting variations on the norm, such as homosexuality, as those things are forbidden in the Jewish faith. Older adults are considered especially important and wise in the Jewish society. Adult daycare and social programs abound in Jewish culture, again because of the requirement to give back to communities. Older adults should be relied on for explanations of traditions and are often available to medical staff when family members are being cared for. There are also specific delegates from the Jewish temples that are available for discussion. They usually have someone on call in major cities or in places where there is a large Jewish population. So those members of that community can be contacted around the clock, especially if there's an emergency in the hospital and family for the patient's unavailable. Retired members of the Jewish community are often appointed as leaders in the temple as either shomerim or shevra kadisha. Both of those items we'll discuss in an upcoming slide. Though placing older adults in nursing homes is permitted, it should be done only when necessary, as it's considered disrespectful. Unless, of course, it is more disrespectful to keep the person in the home. And all people have the right to die with dignity, and the process should not be prolonged when death is deemed imminent by a physician. No heroic measures or anything like that. And Jewish patients are more likely to sign a DNR earlier than some of our other patients. In discussing communities, anyone born to a Jewish mother who is converted to Judaism is considered a Jew. There are various factions of Judaism which should be considered. These include Orthodox, Conservative, Reform, and Hasidic Judaism, which are the largest groups in Jewish culture. There are other smaller groups that are outliers, but there's certainly a large population of all four of these groups in various parts of our country. Communities are usually centered in urban areas and are very close-knit and supportive, and Hasidic Jews only live and work within their communities. Neighbors support one another and often have only one temple in town that they can attend. And finally, we'll discuss death and dying. Upon hearing or becoming aware of the death of a family member, family is to cry out and rend or tear their clothing, which is known as karaya. The site of that clothing tear is dependent upon the relation of the person to the patient. For instance, if it's a parent, you tear the left side of the clothing, etc., etc. Euthanasia is regarded as murder and is expressly prohibited throughout the faith. Though not strictly prohibited, autopsy is discouraged. And any handling of the body must be done with gloves on or with a sheet or a shroud. Now, needle biopsies are permitted and preferred if at all possible, in place of a full autopsy. And donation of organs is acceptable as long as the recipient agrees to be buried, because it is a part of the Jewish caveat that all the organs be buried with the body, and no embalming is permitted. The body must be buried within 24 hours of death, and it must be buried in a plain wooden casket with a Star of David on the lid and holes in the side so that the body comes into contact with the earth. The body must be cleaned by a member of the Shevra Kadisha, which, as we discussed earlier, is a group that is specifically appointed and trained by a temple, specifically for this purpose. And then the body is wrapped in a talit before being placed into the casket. Until burial, the body must be attended by a shomerim, which means guards or keepers, and these are appointed by the temple of the deceased. The shomerim may not eat, drink, or perform a commandment in the presence of the deceased, as it is considered mocking the dead who can no longer perform these tasks. And the body is not to be touched by anyone but the designated religious leader who is commissioned with the cleaning of the body, except for auscultation of the heart to verify death. And finally, in summation, as a society that emphasizes education, the Jews are willing to accept help and guidance from medical professionals, and it's also expected of the Jewish people. From birth to interment, their life is surrounded by ritual and tradition. Medical procedures should be discussed with the patient on a case-by-case basis as views vary widely across communities within this culture, though blood transfusions are acceptable across the faiths. Children are considered adults in the faith at the age of 13 and should be treated as such except in areas where it is restricted by law, for example, signing for themselves. Throughout the lifespan, patients should be accommodated where possible in the practice of their religion for ceremonies and rituals, including candle lighting, dietary restrictions, and times of fasting. Understanding of and respect for these traditions can help our Jewish patients be more at ease with their healthcare professionals and will foster a good rapport and trust between the patient and his or her healthcare providers. Thank you so much for your time today.